let's shift gears to detection. So one of the things that changed the way I think about security is one of our vendors came in and said, you need to start designing as if they're already in. Just assume they're already in your network. There's no walls you can put up that can keep them out. I'm like, okay. So that actually transformed how I thought about security and prevention. The other thing was a CIO told me he contracted with one of the firms. It could be our RSA or one of the firms. And what he wanted them to do was to see if he could get physician credentials on the black market. And they were able to, within, I think, 24 to 48 hours, procure about 5 or 6 of their physicians' actual credentials, which worked on their system. So they were able to get into, a Citrix environment, get into the medical record, and start moving around. And so detection becomes becomes almost the front line now, because you're assuming that they're in your network, they're tooling around. So you almost have to look at patterns of usage. If that doctor's looking at the wrong record or records that aren't theirs, are we tracking all those things? So from a detection standpoint, what are some things we can do to detect? First of all, a decade to track a breach is kind of amazing. What are some things we can do to find those incidences quicker and sort of move that cycle forward?
Good. So again, I'll talk about technology and people side of it, because I think people are really, again, very important. So there are technologies now. So I mentioned data loss prevention, SIM technologies, so security and incident and event management systems that can log in real-time alert. And this is an area, so we spoke about artificial intelligence and machine learning in the context of health care. But this is an area where I'm seeing some really promising technologies in startups that are coming up ways of detecting in very intelligent ways and correlating events and then alerting. So this is an area where there are always some advanced technologies available, and we are evaluating some technologies in this area. But SIM is a must. That's a baseline. DLP, I think, is a must. Many healthcare organizations, actually, the people part is a challenge. So we can have the technologies, but do we have the people who are going to look and respond and sift through all the false positives? These technologies tend to create a number of false positives. And in some cases, the false positive is many, many times more than real incidents, right? Do we have the manpower, the trained manpower? And I think that we don't have. As healthcare, in particular, as a nation, we don't have enough security professionals. There is a lack of security professionals for everyone. The pool is too small to begin with. And especially there is an acute need for more security professionals within healthcare. So I think that looking into third parties, partnering with third parties for 24/7 monitoring is at least in the short term, a stopgap solution. I mean, these are folks like Symantec or like Dell or others who have teams of trained professionals who can monitor the system 24/7. Again, it's not a silver bullet. Things can get through without detection, even if you have 24/7 monitoring. But I think in today's days and age, 24/7 monitoring is a must. And if you're a health system that can afford it to build your own security operations center or SOC, fantastic. But I think most healthcare systems, even our size or even larger than us, cannot afford a 24/7 monitoring. Just that the human capital is just not there. So having the right technologies like SIM, like DLP, and having people who can respond to it, internal and then some external power, but is, I think, one way of dealing with a effective detection scheme, a plan.
Yeah, this is one of those areas where you need to have, it takes a village. It's a series of highly trained experts outside of your organization, experts within monitoring. So I couldn't agree more with what you're saying.